Good afternoon, everyone. This is Dr. Bhupesh from Dr. BKM Institute. Today, we are going to talk about the speaking session first. So, speaking session has got general practitioner clinic. So, basically, you are in a GP clinic. So, basically, आप simple से कह सकते हो clinic में हो. You are speaking to a 40-year-old man and woman who has come to the clinic for the routine checkup. So, एक 40-year-old man या woman आपके पास आया है जिसको चेकअप करवाना है. Traveling overseas next month with work and the general practitioner has asked you. यानी आप नर्स हो, आपको जीपी ने कहा है कि उसको एडवाइस करो कि ट्रैवल इम्यूनाइजेशन प्रायर टू इंटरनेशनल ट्रैवल. तो कहीं पे भी फ्लाई करने से पहले, इंटरनेशनली फ्लाई करने से पहले आपको अपना इम्यूनाइजेशन करवा लेना चाहिए. जैसे कि वैसे तो फॉरेन कंट्रीज में कोई मेजर इम्यूनाइजेशन नहीं होता, लेकिन हाँ, फ्लू शॉट हर मंथ लगता है, एवरी मंथ. वैसे नॉर्मली भी अगर आप देखो तो टेटनस हर 10 डेज बाद, हर 10 ईयर्स के बाद बूस्टर डोज होती है, सो आफ्टर अ डेकेड. सो दीज आर द काइंड ऑफ थिंग. तो अगर आप कहीं पे फ्लाई कर रहे हो तो उसके लिए आप नर्स हो, आपको पेशेंट को बताना है कि आपको ये सब इंजेक्शन लगवाने हैं. फाइंड अबाउट हिज वैक्सीनेशन हिस्ट्री, टेटनस, हेपेटाइटिस ए, इन्फ्लुएंजा. तो आपको पूछना है उसको वैक्सीनेशन के बारे में. तो अगेन, जब भी पेपर में क्वेश्चन आए तो हमेशा लिख दो. सो कैन आई आस्क यू या कुड आई आस्क यू. कैन या कुड ज्यादा अच्छा लगता है. कुड आई आस्क यू अबाउट योर वैक्सीनेशंस. बस ऐसे बोलना है आराम से, फिर आप इजी होता जाएगा. हमेशा क्वेश्चन पेपर पे लिखना है कुड आई आस्क यू अबाउट योर वैक्सीनेशन, लाइक व्हेन, कब लगवाया. हमेशा उसने अपने आप लगवाया, एक्टिव. व्हेन डिड यू हैव योर टेटनस. प्लीज समझो, पास्ट में जब भी क्वेश्चन मार्क बनाना है डिड के साथ फर्स्ट फॉर्म, व्हेन डिड यू हैव योर टेटनस. फिर सिंपल पूछ लो, ओके, टेल मी अबाउट योर हेपेटाइटिस ए, also let me know about your influenza and flu vaccination and the duration of his travel, और आप कितने दिनों के लिए जा रहे हो. Explain that he needs to get vaccinated against typhoid, hepatitis A and tetanus recommended by the. जब भी आप कंबोडिया और वियतनाम जैसी कंट्रीज में जा रहे हो जहाँ पे रिस्क थोड़ा सा ज्यादा है, तो आपको टाइफाइड का वैक्सीनेशन जरूर लगवाना चाहिए, हेपेटाइटिस ए का जरूर लगवाना चाहिए और टेटनस का लगवाना चाहिए. ये आपके लिए जरूरी है. Explain and emphasize the importance of getting his vaccinations updated at least 2 weeks prior to traveling abroad. तो जैसे हमेशा कहते हैं कि वैक्सीनेशन को 2 हफ्ते पहले लगवाना चाहिए बिफोर ट्रेवलिंग, तो इस लाइन को कैसे बोलना है. ऑल्सो आई वुड लाइक टू टेल यू दैट इट इज इम्पोर्टेंट टू गेट योर वैक्सीनेशंस अपडेटेड एट लीस्ट 2 weeks prior to your traveling abroad. So basically make lines very easy. आपको मैं दोबारा बोल के दिखा रहा हूँ. इट इज वेरी इंपॉर्टेंट फॉर यू टू गेट vaccinations updated at least 2 weeks prior to traveling abroad. फिर उसको रीजन दे सकते हो, बिकॉज लगा के टेटनस कैन बी फैटल एंड वैक्सीनेशन नीड्स टू बी एडमिनिस्टर्ड वंस इन एवरी 10 years. टेटनस का बेसिकली डोज दे रखा है हर 10 years में, जैसे मैंने आपको बताया था. अ कंबाइंड वैक्सीनेशन कैन बी गिवन फॉर नाउ. और हेपेटाइटिस ए और टाइफाइड का तो वैक्सीनेशन मैं अभी आपको दे सकता हूँ. एंड अ बूस्टर आफ्टर 6 months, और बूस्टर आपको 6 months के बाद लगवाना है. So combined vaccination can be given for hepatitis and typhoid now and a booster after 6 months. Reassure him that vaccinations are not painful and generally well. So task बड़ा simple हो गया है. And now we do not have much about the task. बिल्कुल simple हो गया. और एक first line को आपको हमेशा पेपर में लिखना है. So first line को पहले लिख दो. My name, good morning. My name is this. I am a nurse here and doctor has advised me to tell you about immunizations as your doctor has asked me. बस सिंपल, अगेन जो दिया है उसी को यूज करो. डॉक्टर हैज आस्क्ड मी टू एडवाइज यू ऑन रिकमेंडेड वैक्सीनेशन ट्रेवल्स प्रायर टू इंटरनेशनल ट्रेवल. तो ये सेम लाइन, डॉक्टर हैज आस्क्ड मी. तो अब रोल प्ले ऑलमोस्ट तैयार हो गया. सो पेपर में आपको ये काम करने के लिए यू विल गेट 3 minutes टू प्रिपेयर. तो 3 minutes होंगे आपके पास ये सब लिखने के लिए, और 5 minutes आपको बोलना होता है. तो अब मैं आपको बोल के दिखाता हूँ. Good morning, my name is Bhupesh. I am a nurse over here and doctor has asked me to advise you on recommended travel immunizations prior to your international travel. So I have heard that you are traveling abroad. So could you please tell me where are you traveling? Nurse, I am traveling to Cambodia and Vietnam. Okay, thanks for letting me know. The second question is that how long are you traveling for? Nurse, maybe 1 month. Okay, so that's great. So you are telling me that you are going to Cambodia and Vietnam and you are traveling for 1 month. I would like to tell you that basically Cambodia and Vietnam are the medium risk countries. So before going to these countries, it is very important to immunize yourself. That is why doctor has asked me to advise you on the travel immunization prior to your international travel. But before I can help you, I need to ask you about your vaccination history. So when could I ask you about your vaccinations? Is that fine? Yes, nurse. Okay. So could you please tell me when did you have your tetanus? Nurse, it has been almost, I think I was 15 or maybe earlier. You know, I had my one vaccination in the childhood and then at the age of 10 or 15, I don't remember. Okay. And how about the hepatitis and tetanus vaccinations? Well, nurse, I don't remember. Okay. So let me tell you that it is really important for you to get vaccinated against typhoid, hepatitis A, and tetanus, as it is recommended by the WHO for the travelers to the medium risk countries such as Cambodia and Vietnam. So I would like to emphasize that it is really important for you to get your vaccinations updated at least 2 weeks prior to traveling abroad. So as you have told me that you are traveling next month, so I must tell you that you should have your vaccinations updated. So first of all, I would like to tell you that a combined vaccination can be given to you for hepatitis and typhoid right now. So that would be good. And also tetanus should be updated once in every 10 years. And otherwise tetanus is a really dangerous disease and it can be fatal. So it is very important for you to have vaccination. So giving you hepatitis A and typhoid now, and the booster should be taken after 6 months. Whereas in case of tetanus, it should be taken once every 10 years. So it is very important for you. And also I will give you an appointment as well for the vaccination of tetanus. But for hepatitis A and typhoid, I'm giving you vaccination right now. Is it all right? Well, all right, nurse, but I'm really worried that it should be very painful, or maybe I don't think so. Vaccinations are generally well. No, I would like to reassure you that vaccinations are not painful at all. They are very safe. The needles are very, very thin. So they are almost painless. Yes, there is kind of a stinging sensation that will happen, but there is nothing more than that. And generally the vaccinations are very well without any side effects. So don't worry, vaccinations do not have any kind of major side effects and there is nothing to worry. Is that all good? Well, all right, nurse. Okay. So I would like to reassure you that all the vaccinations are really painless, and also at the same time, they do not have any side effects. And now I'm giving you vaccination for hepatitis A and typhoid. So can you allow me to give you these vaccinations right now? And then a booster would be given after 6 months. Okay, nurse, that's fine. Okay. And also you're fixing your appointment for the tetanus as well, which would be next week. So you can have your tetanus injection next week so that you can update your vaccination at least 2 weeks prior to your traveling abroad. Is that okay? So basically मैं कर क्या रहा हूँ अगर आप समझो तो मैं उस बात को समझ रहा हूँ कि जब भी उसकी फ्लाइंग डेट है, मान लो टुडे इज 27 जुलाई, सो इफ उसकी फ्लाइंग डेट है 27 अगस्त, तो 2 वीक्स पहले उसको वैक्सीनेशन लगवाना है, यानी 2 वीक्स पहले 27 माइनस 14, सो इट मेक्स अराउंड 13 अगस्त। तो मेरे को उसको 13 अगस्त तक वैक्सीनेशन देना है, तो एक वैक्सीनेशन तो मैं आज ही लगा रहा हूँ, टुडे ओनली। So I will give the vaccination for today only of hepatitis and typhoid right now. So that would be good. And the next vaccination for tetanus, I will give you around 3rd of August. 3rd of August. So by the time you would be flying on 27th, it would be 2 weeks. 2 weeks पहले वैक्सीनेशन हो चुकी होनी चाहिए. So that is why I am using this chart. So एक बार मैं दोबारा बोल देता हूँ आपके कन्वीनियंस के लिए, just to make sure. बिल्कुल सिंपल. Good morning, my name is this. I am a nurse here and doctor has asked me to advise you on the recommended travel vaccinations prior to your international travel. So before I can help you, I need to know about your vaccination history. So could you please tell me when did you have your tetanus? Okay, and how about hepatitis A? यानी इस वर्ड को सिर्फ ऐसे बोलता हूँ, जब फ्लो में चल रहे होते हैं क्वेश्चंस तो एक एग्जांपल पूछ लिया तो सेकंड को बस how about hepatitis A? Okay, and please let me know about influenza or the flu vaccination. All right. So, okay. Now I need to tell you that vaccinations are very important, especially against typhoid, hepatitis A, and tetanus. And it is recommended by the WHO for all the travelers who are flying to Cambodia and Vietnam, as they are the medium risk countries. So in these countries, chances are higher to get infection for typhoid, hepatitis A, and tetanus. So please understand, it is very important for you, as tetanus can be fatal. Also, I would like to tell you that it is very important to get your vaccinations updated at least 2 weeks prior to your traveling abroad. So basically, if you are flying next month, so in the next 2 months, we need to give you the vaccinations. And tetanus vaccination is very important. It can be fatal and it needs to be administered once in every 10 years. Apart from this, a combined vaccination that can be given right now for hepatitis A and typhoid, so which I will be giving you now after the counseling. And also a booster dose should be taken after every 6 months for these two diseases. Apart from this, flu and influenza shots should be taken once in a year. So it is also important for you. So have you understood everything? Yes, nurse, but I'm worried about the pain. Don't worry, vaccinations are absolutely painless. They are not painful. There can be a stinging sensation, but they are not painful. And generally, they do not have any major side effects. So there is nothing to worry. These vaccinations are very safe. All right, nurse. Okay, then. Okay, so now you can prepare your mind, and I would like to give you the vaccination for hepatitis and typhoid right now. And then after a week, we will give you the vaccination about tetanus and maybe a flu shot as well. So by the time you will travel, it will be 2 weeks prior to your traveling. So is it all good? All right, nurse. Okay. Reassure bada important hai. I need to and I would like to reassure you that these vaccinations do not have any harmful side effects and these are painless. And also these vaccinations are very important and they are part of your protection and immunity. So they play a very important role in acquired immunity. Is it all good? Yes, nurse. Okay, then take care, have some rest. So I'm just going to prepare for the vaccination of hepatitis A and typhoid. Is it all right? Okay. That is how you do your role play. It's just about maintaining flow. The more you talk in English, the better it is. Again, I would like to emphasize on the same point. क्योंकि अगर आप English बोलोगे तो कोई दिक्कत आएगी नहीं. एक दो लाइनें ऊपर नीचे हो जाती हैं, उनसे पेपर नहीं हिलता. But again, it's just about maintaining flow and being confident. So this is Dr. Bhupesh from Dr. BKM Institutes. Our contact number is 76967 34256. For new students, मैंने आप सबके लिए रिकॉर्ड भी कर दिया है. आप इस स्पीकिंग को एक बार भी सुनोगे तो आपको फायदा होगा, क्योंकि मैंने 2 बार रिपीट कर दिया है. तो एक बार सुनना भी काफी रहेगा इस स्पीकिंग को, जब आपको अपलोड किया जाएगा यूट्यूब पे और आपके ग्रुप्स में ये शेयर किया जाएगा इस स्पीकिंग को फॉर न्यू स्टूडेंट्स. थैंक यू.